if you've got 3 cycles and you haven't fallen pregnant, that's actually a sign of infertility, that there's something going on. And the reality is a lot of people are facing infertility these days. It's so common because we've got so many environmental factors that are impacting our hormones, our nutritional deficiencies, our heavy metals, our methylation, unfortunately.
A nutrient that I adore for methylation, reducing gestational diabetes risk, reducing preeclampsia risk, optimizing egg quality to touch base on for fertility and preconception as well.
Welcome back to Balance Things Uncut, where we talk about health, wellness, and everything in between. Today, it's Madison and I, and we're going to be talking on everything preconception and pregnancies, the things you should do, the things you shouldn't do, and everything in between. So Madison, take me through a bit more about pregnancy and supplements, what you would be not taking and things that you would be taking, regardless of what your test shows.
So pregnancy, non-negotiables, magnesium always, prenatal always. I prefer prenatals with activated folate so that anybody, whether you have MTHFR or you don't have MTHFR, you've got the folate that you can synthesize. No added synthetic folic acid, so even some only products still sneak in folic acid, even though it says with activated folate. So always read the label or work with a qualified prac that's going to prescribe you the right one for you. Prenatal wise, I'm always looking for ones without iron because iron can be really pro-inflammatory. It's often blocked by other nutrients that are included within your prenatal. So you're not getting optimum within that anyways. It's about 5 milligrams of iron in a prenatal, so it's almost nothing. I like to take that one separately every second night or first thing in the morning every second day. So when you're taking that iron, you're then allowing that hespedrin inflammatory compound to reduce, so that you're optimizing that iron absorption as well. Calcium and magnesium together, very important, especially from pretty much end of first trimester. So that's helping with your energy, your muscular contractions. Lots of people have restless legs during pregnancy, and they often go into supplement with magnesium, and that often isn't enough because we've got to think of those other electrolytes as well. So things like calcium, making sure that we're getting those in, because if you are not nutritionally replete prior to conceiving, if you're not staying on top of that during your pregnancy, baby is just going to take all of your nutritional stores. So you can only give them what you have. And if you're not staying on top of it and you're not supplementing, because even with the most clean-cut, perfect diet, you're still not going to be 100% nutritionally replete. And I think that's a very important factor.
And another fact that a lot of people miss is they go on a prenatal and I've got everything I need. You don't, unless you're having a high amount of choline in your diet and omega-3s, which you generally can't get enough of for the needs that you need. I think the milligrams for EPA and DHA is 200 to 500 milligrams for pregnancy needs, and that'd be eating fish every day. If you're not checking in on the type of fish you're eating, that can have some heavy metals with it as well, depending, especially if you're eating higher sourced
bottom feeder
fish like shark, then there's more likelihood that you're going to be getting heavy metals as well, and that's going to be really disruptive to bub's fetal health and growth and development and risk of things like ADHD and autism, because those heavy metals really impact that development. Again, omega-3s are highly studied with neurodevelopment in fetuses, so the risk of ADHD and autism developing in pregnancy when it happens in utero is dependent on the amount of omega-3s you're having. So the best thing to have is having a tablet that's got some omega-3s and choline in it, as well as your prenatal. Generally, you need both of those because your prenatal's not going to have enough omega-3s, even if it does have some in there.
And that omega-3s will also reduce the risk and likelihood of your child developing eczema as well. Lots of studies to support that. And choline, it's kind of a more trendy nutrient. Like, a lot of people are talking about choline. Lots of brands are revamping their prenatals to include choline now, which is fabulous. But it's still not enough. So you've still got to look at additional choline supplementation or adding it in extra through diet. So diet alone for choline, I need to fact check this, but I feel like an egg has about 20 milligrams of choline. You need at least 400 milligrams of choline during pregnancy.
Yeah, it's quite a lot.
So unless you're having a dozen eggs a day, no perfect diet's gonna give you enough for that. And choline's very important for baby brain health, eye health, development and function. It's also supporting those methylation cascades as well.
If you also have MTHFR and you're going through pregnancy, not only do you need to have activated folate, but you want to be checking in on some other factors like homocysteine. And you also want to be checking in on other types of nutrients that you might need in high demands, like B12 and magnesium. The reason being is because homocysteine raises in pregnancy, and that can increase the risk of things like postpartum depression and a few other pregnancy-related health conditions too.
A nutrient that I adore for methylation, reducing gestational diabetes risk, reducing preeclampsia risk, optimizing egg quality to touch base on for fertility and preconception as well is CoQ10. It is, or ubiquinol is the active form. So
I've also found it reduces high blood pressure, which then reduces the risk of preeclampsia as well. So it's such a great preventative. And again, if you've got, sorry for interrupting, but if you've got methylation issues and MTHFR, check your homocysteine before you fall pregnant, because we want to keep that at a nice healthy 4-to-6 ratio, like between 4 and 6. I believe that's the marker.
Ideally
like
6.
Okay.
Yeah.
Yep. So at that point, you don't want it above 6, because then it's going to increase your risk of preterm labour, of high blood pressure and preeclampsia risk. So negative to fetus. So we really want to check in with that prior to falling pregnant if you've got MTHFR.
And CoQ10, so it's the active form is ubiquinol. So all the studies are done on CoQ10, and it's ideally around 300 to like 600 milligrams of CoQ10, ideally 600. But when you're looking at that, you kind of half the ubiquinol. So if you're going 600 milligrams of CoQ10, you need about 300 milligrams of ubiquinol to be making sure that you're hitting that CoQ10 requirement as well. And that's something that you can be on all throughout your preconception journey into postpartum. It's a high antioxidant. It's going to reduce down any oxidative damage that might be caused from heavy metals. It's also going to improve your energy level, because it's feeding the ATP, so like your cellular energy, and it reduces brain fog and fatigue as well. So it is a really beautiful nutrient to be on.
Definitely.
Probably one of my favorites.
Another key spotlight for me is NAC. Obviously, you don't take it after 32 weeks, but NAC is so awesome because it reduces the risk of miscarriage by 300%, especially from 12 weeks prior. Even in preconception, it helps with boosting fertility and improving egg health as well.
Yeah, it's really beautiful. I do love NAC.
It's so good. The other thing that I wanted to touch base on is in pregnancy, what other health conditions we kind of see in other spotlight herbs, nutrients we use besides the prenatal and DHA and choline.
So even if you've been pregnant and you're going to fall pregnant again, that's a really important time to be doing that preconception work, because we've got preeclampsia and gestational diabetes. So each subsequent pregnancy, you're at an increased likelihood of developing gestational diabetes. Preeclampsia, your biggest risk is your first pregnancy, and risk is supposed to, studies show, go down after each pregnancy from there. Gestational diabetes, I've got a lot of theories on it about why it increases in second babies, because when you're going to do an oral glucose test, you're going first thing in the morning, you're organizing your first child to go here, there, and everywhere, or coming with you for a 3-hour trip to the phlebotomist pathology clinic, and you're highly stressed. So as you're stressed, your body's secreting more sugar to support your cortisol response, and then you're going in, and that's usually one of the ones that it's the first test, it's your fasting one that's elevated, and it's one that I see happen so commonly with second pregnancies. Reducing that risk, so CoQ10, inositol, magnesium, carnitine, herbs like gymnema, cinnamon, and stacking your food so that you're having your protein and fiber first, fats, and then carbohydrates or sugars last, help to manage and stabilize that blood glucose response. So prevention's always better than fixing the problem once it happens. So if you do test positive for gestational diabetes in pregnancy, I think it's a between 50 and 90% increased likelihood for you to develop type 2 diabetes later on in life, and also for bub to develop that as well. So I stress very hard on pregnancy health and preconception health. I've had friends and family members that really stress about the types of cots that they want to buy and getting the bedroom set up with all these bougie products.
You can literally change your child's future health by optimizing preconception, or at the very latest, be supporting your pregnancy.
Yeah.
There's so much you can do. It's more important to me than buying an ice pram.
Yep.
Like it
So
literally is. You're changing your child's future health by what you're doing.
Your body is your baby's first room. So that needs to be really focused on. And there is a bit of a wave towards that now. It is an expense, and it is an extra expense on top of $300 scans that you're doing and prioritizing everything else. But a baby's needs when it's born is quite low. Yep. And having a mum that's nutritionally replete, that's not having high anxiety, this is so much more important. And doing that preconception and pregnancy care is so important.
It's not something that should be like, oh, should I do this or not? Should I do this? It should
be a non-negotiable. Jinx.
100%.
Love that.
So yeah, talking about pregnancy before we dive into preconception and miscarriage and things like vaginal microbiome and how that impacts things. So some key factors that I would look into that are non-negotiable in pregnancy is one, making sure you've got an activated folate and not have folic acid in your prenatal supplement, having DHA and choline in enough demands either through supplementation, because it's really impossible to get the needs you need in pregnancy without that. The other things would be looking into proper testing, not just what the doctor's testing in regards to nutrient levels, but checking in of your zinc, magnesium, iron, folate, B12 and homocysteine. These factors are going to greatly impact your bub's nutrient profile when they're born and their deficiency risk, but also impact the risk of preterm birth, preeclampsia and everything in between, and postpartum depression. Then the other two things looking at either preconception or at the worst pregnancy is a gut microbiome test and a heavy metal test. The reason being is because, welcome to chime in whenever you want, but gut microbiome testing is so important because that good bacteria and the bacteria and viruses you have from the male perspective, which Madison will mention, but also from the mum's perspective, from about 20 weeks onwards, we transfer our microbiome to our baby. So it's really, really important to make sure you're optimizing that orally as well, which Madison will touch on. But that good bacteria is going to impact their risk of things like ADHD as well.
Recurring
fussiness, recurring sicknesses, flus, viruses, all
colic,
of that.
Everything.
Reflux, colic, intestinal dysbiosis have studies on that. And then fifth, our heavy metals. If we have heavy metals from us as mothers,
And
if
dads.
we have heavy metals like copper, then what's going to happen if we haven't cleared that out properly ourselves, then we're going to transfer it to bubs, and then they're going to have issues from that too.
Because all those heavy metals are passed down through the placenta, so they cross that blood-brain barrier. So there's heavy metals, aluminium, mercury, lead, all of that's passing through placenta, passing into bub, and being neuroinflammatory in utero to bub as well, which is when you strip things back and you tell your clients that it's not a scare tactic, it's a risk reduction. And it's really important. It's some of the most beautiful work that we do in the clinic. So oral microbiome health, lots of new information coming out about oral microbiome health. So the oral microbiome of mum is what closely resembles the fetal microbiota. So we understand that there's a seeding event that is birth, and the feeding event of breastfeeding, but their bub is in a microbiome in utero, and that closely resembles mum's oral microbiome. So if we are depleting calcium, we're starting to see bone mineralization and worsened teeth. There was an old wives' tale, like one pregnancy, one tooth. And I've had some friends that have actually lost teeth during pregnancy. because of that not being nutritionally replete. But that bacteria that's present in your oral microbiome, so that's things like Streptococcus salvarius, Streptococcus oralis, and Fusobacterium, they're all oral microbiome pathogens. And if we find these in your gut, that can be from oral transfer. So bleeding gums, what happens during pregnancy? Did you get bleeding gums when you were pregnant? I had like gum sensitivity. It wasn't too bad. But when you brush your teeth, sometimes you can get like little pops of blood coming through. That's a really easy way to get that bacteria, because any cuts in the mouth, the bacteria then goes systemically through your entire body. And then once again, passing that placental barrier into bub. So that's a way for them to get fuso. Fuso in the gut can trigger the onset of endometriosis. It's really pro-inflammatory once it's in the gut, and then that's what's passing down to bub. So we're seeing more inflammation and more babies. We see so many babies with eczema in the clinic, so reducing that risk and likelihood of there as well.
So what we do for our oral microbiome in the clinic, if you're a prac and wanting to know, is we love myrrh. Myrrh really helps with the kill off of the pathogens, because if we're just using good bacteria, again, a lot of times we actually need to kill that bad bacteria, because it's just going to fight with the good bacteria we put in and kill it off anyway. So we love to use myrrh dosing, and then we'll come in with some activated probiotics, the oral microbiome sachets, and they work great to kill off that fusobacterium and strep.
They're beautiful too. They make it feel like you've gone to the dentist. So you use them after you brush your teeth at night. You tip it in like a sachet, rub it over your teeth and swallow.
Another thing to keep in mind is some factors that also impact our oral microbiome, like mouthwash as well, and the type of toothpaste that you're using is key.
And chewing gum. So switching out for like a regular, I don't even know what types of chewing gum they have anymore. But switching for a xylitol based one. So xylitol is really positive towards the oral microbiome. Making sure that you're using mouthwashes. I love the Weleda Rithania mouthwash. That one's really beautiful. It's really astringent, so it helps to tighten those gums as well and reduce that bleeding risk. Toothpastes, making sure that you're using a good quality toothpaste. One of my favorites at the moment is the Mugu Moothpaste. These are all really good, easy swaps to do in preconception. So making these steps towards that. And even if you're already pregnant, swaps to do during pregnancy as well. The oral microbiome can also, if you've got an optimal oral microbiome, that can also reduce the risk of early pregnancy loss. Another very important microbiome cavity would be the vaginal microbiome. So very overlooked in infertility, pregnancy. It's pretty much only touched on between, if you have a doctor's appointment or you get admitted to the hospital, between 32 weeks in birth, and they check, and they're only checking for strep. And if you come up positive for strep, I'm sorry, but you're in the hospital for 3 days. You're pumped full of IV antibiotics, and that's going to come in and disrupt your gut microbiome and bub's gut microbiome. So something I do preventatively for all of our pregnant women in the clinic is roughly around second trimester, if we've had a low risk first trimester, if we're not doing it already, ideally preconception, because you can pick up strep at any point in time of your pregnancy. So we do a swab to check. If we have a bit more of a high risk, if we've had reoccurring BV, I'm wanting to check that sooner, because BV, which is based off of, oh my gosh, what are the bacteria? Now I've gone spaced. Gardnerella and Atopobium. And ureaplasma is really pro-inflammatory, but Atopobium and Gardnerella are the two bacteria that are associated with BV. That increases your risk and likelihood of early pregnancy loss prior to 18 weeks. So when you feel like you've gotten through to that safe part, I do really push for vaginal microbiome testing in the clinic. I think it's about 130
things that we can do to prevent, even if you are pregnant as well. And it's so indicated. So if you've got a past history of BV or thrush, and you're having some infertility, that would be one of the first testing that we'd be doing, is some vaginal microbiome swabs to actually see what's going on, so we can clear that bacteria, so we can get you pregnant.
And reoccurring candida, reoccurring thrush, if you fall pregnant and for some reason you need antibiotics during that pregnancy, your risk of candida and thrush goes up. If you have candida or thrush, whilst pregnant, and then you go to give birth and it's not fully cleared because it's still in that cavity, then you're giving birth to bub. Candida is like a weed. It just goes crazy. Bub's picked it up. It's in their oral microbiome cavity now. They've got oral thrush, and then mums end up with nipple thrush, and it's this really horrible cycle that can be very well prevented by doing a comprehensive vaginal microbiome test, going in with very key specific probiotics. So the vaginal microbiome is the opposite to the gut microbiome. We don't want diversity. Gut microbiome, we want diversity. Vaginal microbiome, we don't want pretty much any pathogens present in there. We want it to be mostly lactobacillus. So there's quite a few different lactobacilluses that we would accept. We don't need all of them, but we do need a good amount of those in good amounts that we're having, because that lactobacillus in the vagina is secreting lactic acid, which is then controlling that vaginal pH as well. And that's going to ward off pathogens. It's going to keep that strep away and then reduce your risk of hospital admittance and antibiotics during birth as well.
Yep, definitely. Going back to pregnancy a little bit more, what are some signs that you would look out for if you're pregnant to see if your oral microbiome is impacting fetal health?
Really intense bleeding gums, halitosis. So if your partner or you are noticing bad breath, that is a sign of dysbiosis. If you're seeing teeth rot or feeling tooth sensitivities, all signs here as well. I do like my preconception clients to go in for a dental check-in prior to conceiving as well, so you know, is there cavities, what's going on in there, so you can get on top of it beforehand and reduce that risk.
And some dietaries to think about in order for a safe and healthy pregnancy. A lot of doctors will talk about a lot of this, but some key ones for us is reducing Listeria toxoplasmosis.
Toxoplasmosis,
risk with cat poo as well, so not changing and cleaning up after your cat. And the other one is also a bath. Raising your temperature too much early on, lifestyle-wise, can actually cause a miscarriage too if you're not careful. Is there any dietary lifestyle factors that you would say is really important besides obviously whole foods and a healthy balanced lifestyle, so that you would reduce the risk of nutritional deficiencies in pregnancy?
I love well cooked foods, so going back to like TCM practices, lots of well cooked stews, easy to digest foods, so you're getting optimal nutrients in. Going on a Mediterranean based diet, so you're getting in all your healthy fats. Really good at managing cholesterol, blood pressure, reducing gestational diabetes risk. That's one of my favorite dietary supports during pregnancy. And then making sure that you're getting enough protein in, because your caloric intake during pregnancy, it's not eating for two. It's about, I want to say, 30 grams extra you need in like the first trimester. So it's not, I'm pregnant now, I'm eating for two.
And I'm pregnant now, I can eat whatever I want.
Yeah, it's eating more consciously, because what you are having is what's then transferring through to bub. And as I've said in previous podcasts as well, where you can, eating organic. If you can't afford organic, clean 15 and dirty dozen.
Yep.
And then
that heavy
soaking.
metal contribution is going to impact bubs too, and that's coming from non-organic produce and the type of water you're drinking.
And the
Get us out some
glyphosates.
water tank from our website, so you're reducing all this heavy metals and remineralizing, so you're reducing heavy metal risk.
In your water.
And then to have removing all the dirty dozens from your diet if you can't afford organic, and soaking your vegetables in some apple cider vinegar. It's going to make a world of a difference for your future baby. Any more go-tos in pregnancy, would you say? Like, they're my non-negotiables is, you know, DHA and choline, a good quality, active folate, prenatal, checking in on those bloods and microbiome and heavy metals that we talked about, but then also that healthy diet and not overeating as well, and overindulging in pregnancy is key.
I hear a lot of clients that say, oh no, my doctor said all my pathology's fine.
But they don't send it to you thinking it's fine.
Yeah, and then I get it and I'm just like, okay, we're at B12 of 216. Like, that's low. Like, it's, I think their cutoff's 200. I want it around 600. I've harped on about vitamin D ad nauseum in previous podcasts. being vitamin D replete is going to reduce the risk and likelihood of atopic dermatitis, so eczema.
And also postpartum depression.
Postpartum depression,
Sorry.
yeah. And allergies as well. So very, very important
Over
to be...
100 through all of your pregnancy.
Yeah, so keeping that stable, making sure that liver's functioning well and effectively. And most of the time, most people in Australia aren't converting that vitamin D effectively from the sun. So very important one to be checking in on. And thyroid.
Yeah, and while we're in pregnancy, talking a bit more about, there's actually so much things we can do in pregnancy to help. A lot of people think, oh, I can't go see a naturopath because I can't do anything, it's not safe. We can use herbs for even reflux. We can use herbs for nausea and morning sickness. We can use herbs and nutrients to reduce cholestasis risk once it's even developed. I've had a client that I helped with their preeclampsia even when it was developing as well.
And it's management. It's having that person supporting you
and checking
continually.
in, instead of us just checking in when symptoms develop, we're checking in prior to check your bloods that are staying healthy, and if they're a little bit out, we then go replace the nutrient, and then it prevents that condition from actually developing. And that's why it's key to have a naturopath working alongside you in pregnancy.
Things like postpartum thyroiditis, so your thyroid throwing out in postpartum, but like staying on top of your selenium, staying on top of your iodine during pregnancy, because Bub needs that as well for their healthy thyroid. So all these little things that your naturopath's working alongside with you as well. I just had one of my clients, her first pregnancy, very long dragged out labor. It was over 30 hours. I know she won't mind me sharing, and I'm not disclosing any information. She's just given birth, about 2 weeks ago now, and he arrived about an hour of active labor, and she ended up free birthing by herself, which was just an absolute whirlwind for her. And she was doing all the right things. She had done all the supplements, she had done her herbs to prepare a uterus. Like, there's so much that we can do naturopathically to support you, and making sure that you're staying on top of things, being held accountable, doing all those things. Like, a naturopath's on your team, and we don't stop caring about you once Bub's born, which is a huge thing that I see in medicine. So, like, not knocking medicine in any way, shape or form. It's definitely made pregnancy and birth a very safe environment. But how I felt during pregnancy is that I was the vessel to facilitate the birth of my child. And then my child was born, feeling. And that was it. I think I was a week postpartum with Hamish, and they offered me birth control, and then boom, that was it. All done.
So sad.
So I had given birth to a healthy baby, and my job as a female reproducing was finished. So there was no checking in postpartum as well, which is also very important. I was severely iron deficient in my pregnancy. I did get it up before giving birth. I had to stay on iron in postpartum as well, but there was no care or check-in for that. Fatigue hit in, breathlessness hit in, and I was like, no, I need to check this myself and continue going. But there's so much we can do. Even nausea. So I was in student clinic when I was pregnant with my last child, and I was doing one of my friends a solid and being a client for them, and they prescribed me some ginger drops during my first trimester, and it was life-saving. I accidentally just dropped them straight on my tongue. I don't know if you've ever done straight ginger.
Wild.
It
when
is
it's like
not
straight
nice.
ginger.
Yeah, it's spicy. And then I read the label, and it said to add it into water. So even as a naturopath, you need somebody to hold you accountable and to be there. So I feel like, pregnancy care is so important.
Yeah, like for me, some pregnancy and morning sickness, reflux and morning sickness go-tos, I would be doing ginger, chamomile, marshmallow root. It's just so nice and safe in pregnancy.
Bit of slippery elm.
Slippery elm's so good too. What other type of herbs do you use for different types of conditions in the clinic?
Those ones would be probably my main ones, especially for that. It's all about different stages of pregnancy. So first trimesters, reducing early pregnancy loss risk, using things like NAC, L-arginine, carnitine, ginger for that nausea support, optimizing nutrition a lot through there as well, getting our clients onto proper nutritional support, checking in on their specific needs and requirements as well. So,
and not just checking your blood test once. Go check it at 12 weeks. Go check it at 20 weeks. Go
Yeah.
check it at 30 weeks. We recheck on those nutrients to make sure things are staying healthy. And if they're not, we're supplementing with them to make sure that no negative birth outcomes occur.
yeah. And then second trimester, I go into microbiome work. So whether that be
Yeah.
vaginal microbiome, oral microbiome, gut microbiome.
Because that's when things start transferring over and start impacting fitness.
And then third trimester, I'm focusing really heavily on nutritional repletion. If we're low in any way, shape or form, getting that up as soon as we can, as Bub's taking that transfer, and then optimizing, what were you going to say?
I was just going to say, yeah, third trimester, biggest nutrients that we find start to be lost because essentially from third trimester on, all we're doing is growing in size. So that's when a lot of nutrients are getting taken from us. So calcium, magnesium, iron are big ones. They're the key ones I find at highest deficiencies from third trimester. What about you?
Because you do hemodilution in that time, and Bub's taking its first 100-day iron download from you in third trimester. So even if people are borderline with iron, I'm still putting them on a very low dose with like supportive.
We want you to stay
299V
above
lactobacillus.
30 ferritin.
Oh yeah, and it's honestly, I think I've seen iron okay in 2 patients.
Yeah, I know, it's crazy. So talking about pregnancy, what would be your keys? We've done an iron podcast, so we're not going to talk a bit more in too much detail about iron sources and where to get them from, because it is the biggest deficiency we see in pregnancy, because you could go to that podcast and listen to it. But is there any other key nutrients that you would be recommending to support magnesium and calcium? My go-to is bone broth.
I do love bone broth, and it's so nice in first trimester. So you're getting in collagen, you're getting in protein, you're getting in amino acids. It's very nourishing. Cup of warm bone broth first thing in the morning, sprinkle of Celtic sea salt. You're getting in the minerals from there as well. You can sip on that all throughout the day, especially when you're feeling nauseous. It's one of the like pregnancy heroes that I use, especially trimester 1, and even through to third trimester as well, because once again, it's like a natural electrolyte. It's fabulous, and you're getting that nice protein hit as well.
And you're getting the nutrients you need to reduce the risk of the deficiencies of that are most likely to occur.
Yeah.
Another thing is, touching base on morning sickness a little bit, if we go into that in a bit more detail. Some things that I notice help the most with cholestasis risk and morning sickness risk is doing some prep prior to falling pregnant on liver work, so liver detoxification pathways. Doing that work, I've had clients that have had cholestasis in the past and then have gone to a second pregnancy without cholestasis just from doing 2 months of liver work. And what I mean by liver work is detoxification elimination. So we'll use things like turmeric or St. Mary's thistle or P2 detox, which we absolutely
Broccoli
love.
sprouts.
NAC, broccoli sprouts, lots of cruciferous vegetables in the diet. That's the best thing you can do for prevention. But when we're hitting morning sickness again, we do like ginger and marshmallow root, morning sickness wise. And then we'll use some NAC as well to help with morning sickness, because it's still so nice and healthy, and miscarriage reduction in early pregnancy when we can use it. And then diet wise, just thinking about having lots of small meals that are not going to make you feel more sick. So other times they're crackers, but then looking at trying to get some proteins in. So protein's the key in reducing morning sickness diet wise.
Yeah.
So protein powders, NutriOrganics has a protein powder that's safe in pregnancy, which I love. It's not too, it's pretty bland in flavouring.
Yeah, it's not too gritty either.
You can do it, put in oats. Oats are really, really good.
Oats, very easy.
Chia seed pudding, overnight oats, doing a protein powder in some water if you need to. But the key is just having small amounts of protein through the day. It's going to reduce your morning sickness the most.
And it feels better coming up, like if it's thinner.
Yeah, it does. It does.
And yeah, that liver work as well, really important if you've had HG previously, so hypermenses.
Yes, biggest thing we find that prevents HG is liver detoxification and clearance. Like optimally, we want to do some liver enzyme testing or beta-glucuronidase testing to actually see where your liver's at, and even methylation to see if MTHFR gene and that lack of methylation, and because that's a detoxification pathway, is also impacting that as well.
Impacting your sulforation pathways. And where was I going with that? taking for H. pylori as well is a bit of a risk factor for HG. So if you've had HG previously, like work with one of our nats and we can help reduce the risk. So we can never say it's 100%, no, you're not going to have HG. There is obviously a genetic component that studies released this year as well, talking about that risk. But we can definitely minimize overall risk as well, which is fabulous.
100%. So before we go into preconception and miscarriage risk, which is such a big topic in itself, we could talk hours on that. I wanted to quickly touch on birth preparation and why it's so important.
Yeah.
So not only does labour and the type of labour you have an impact on bub's health, and we don't want you to feel guilty from the type of birth that you've had in the past, but we just want to optimise health outcomes so that you can have the most positive outcome, because obviously a vaginal birth is seeding bubs through your vaginal microbiome, so it has a benefit. What else does vaginal birth have benefits for?
It's helps with connection with bub. So studies have shown there is a reduced breastfeeding capacity if you go in with a C-section as well. So I think it's less than 50% of women with a C-section will go on to breastfeed, and that can be, once again, not knocking anybody for how they feed their child, but if you're really wanting to breastfeed, then optimizing that. Vaginal birth is, I've had 3 pregnancies, 3 very different births, and I could say my last 2 that I actually prepped were so much better, so much easier.
Yep.
So
when we
you're
talk
not
about
recovering from C-section.
Yeah, it's easier on your body to have a vaginal birth as well. And it's better for your baby because we're getting that vaginal seeding as well. So for birth preparation, what we actually do and what we mean by that is we actually want to help support ripening the cervix. So why we want to ripen the cervix and how we do that is through different herbs and even things like acupuncture and hikes and walks. Ripening the cervix is so important because when we have a ripe cervix and it's nice and plump, then what happens is it dilates quicker, which reduces the risk of negative birth outcomes and the risk for C-section. So we want to have a ripe cervix.
And then reduces risk of intervention.
It does.
Lots of studies about intervention and then negatively impacting maternal mental health postpartum as well with interventions.
Yeah. So in order for us to birth prep, we use herbs that have been found to help ripe the cervix. So the go-tos would be raspberry leaf. So we actually use this in a herbal tonic, so it's a lot stronger than what you can get out of a tea.
And it tastes so much better than the tea. And the amount of tea that you have to drink, like
for an effect is crazy. Things like shatavari, withania.
Love shatavari.
Any others that you pop in there?
I
use fennel at times.
Yeah, I use chamomile.
Chamomile's helpful too.
Chamomile's really lovely because helps to reduce like kind of reflux that happens towards the end of pregnancy as well. Supports that digestive capacity, and it's a nervine tonic, so it helps to reduce that anxiety as you're approaching birth. Yep. Really love chamomile for that, very gentle. Shatavari is probably one of my all-time favorite herbs. She Who Has 1,000 Husbands.
Nice enough.
It is so beautiful. Tastes horrible.
But they're our go-to herbs, which we would take from 36 to 37 weeks pregnancy in the clinic. The other go-tos is starting to replace magnesium and calcium. So every contraction you have in labour, you are losing magnesium and calcium. And so typically a lot of mums will be quite depleted of those nutrients postpartum, and that can cause that postpartum blues and those hormone shifts to be worsened as well if you're at loss of that. So we actually get clients that start taking supplementation of that at 37 weeks onwards, and then we continue every 4 hours in labour if we can, even if we're popping it in an ice block.
Yeah, or making it into a labour aid. So things like coconut water, which you got potassium, magnesium in small amounts. It is not a nutritional supplement by any means. Really good vessel to pop your calcium, magnesium in, a little bit of ginger to aid in nausea. Once again, every pregnancy is different. I had mad nausea with my second birth, and that was horrible. So that labour aid was life-saving for me. A little bit of lemon or lime juice, pinch of Celtic sea salt, amazing, super good. Pop it in an ice block if you're labouring at home. Something cold helps to just numb everything.
It does. So birth prep outside of supplementation, our go-tos would be some raspberry leaf. Menstrual dates, the studies show you need to have more than 7 menstrual dates a day from 35 weeks onwards to actually ripen the cervix. So that's a lot. If you've got gestational diabetes or blood sugar dysregulation, we wouldn't recommend that.
I always pair that
with nuts.
with nut butter.
Peanut
so
butter.
Like you can make really delicious ones with like nut butter.
Or make brownies with sweet potatoes so that you're balancing that glucose hit essentially.
Yeah.
If you want to ripen your cervix that way.
And if you've got oxalates, you'll probably get the shits with that.
Yeah. The other things that do that have a positive effect. Look at us. Other things that have a positive effect birth prep wise is things like hikes, things like walks, continue your normal exercise routine if you feel like you can, and having sex.
Yeah.
I'm just trying to think of anything else that I've missed.
And relaxing's huge because it's like, how do you relax when you can't relax? Mindfulness, journaling, writing to your future child's really beautiful. So you can do like a kind of lead up to birth journal, and it's something really amazing. So I've got those to put in my children's like 21st boxes. So when they turn 21,
cute. I didn't do that.
With like papers from their birth, which I don't even know if they do papers anymore, but they, you can do things that are really beautiful in that sense. Perineum massages, and then even things like evening primrose oil helps to all ripen the cervix. Baths, Epsom salt baths in tepid water, really beautiful because then you're getting in that transdermal magnesium support as well.
Another thing I wanted to say is the amount of the ripening of the cervix reduces postpartum blood loss as well. So directly notice this effect. So with Indiana, I didn't do any birth preparation or anything. And I was just like, oh no, I've got this. My body doesn't need nothing. With Sterling, I was like, okay, I don't have this. I need support. And I worked on magnesium and calcium supplementation. I did my birth preparation from 36 weeks onwards. I did all the things. I had a home birth with him as well versus Indiana in a hospital, and I had epidural and whatnot. Anyway, going back to Sterling, I stopped bleeding 7 days postpartum with Sterling, whereas with Indiana, I didn't stop bleeding for 5 weeks postpartum, and I had the same type of posterior vaginal birth with both of them.
Yeah.
Which is crazy to think that my blood loss stopped so rapidly, which is reducing nutrient loss of specifically of iron as well. So reducing risk of postpartum blues and depression just through doing some birth preparation.
I had some really bad postpartum blues with my first pregnancy. No birth prep, like nothing during pregnancy. It was not the optimal time. I think I was taking Elevit at the start, couldn't stomach it. So like the biggest naturopath cringe ever.
Were you studying?
No,
God,
God,
I
no.
was going to say, what type of student are you?
No, well, it gets worse. I stopped taking Elevit to take Swiss gummy prenatal.
So if you're listening to this, don't take
do what
either
I did.
of those.
They were absolutely horrible. I couldn't stomach them when I was pregnant with Archie. So a lot of the prenatals now are formulated in capsules, so you can actually open them up and put them into smoothies.
Our go-tos is NaturoBest and the Natal Naturopath. They're the two recommendations that we would have if you're looking for a healthy prenatal, plus going on omega-3 like a DHA and choline or Nordic Naturals prenatal DHA. All of this is on our online website as well, by the way, guys.
Yeah.
So we've got all of the access to everything we ever recommend essentially on our online website or through our practitioner hub, which has our practitioner grade supplements.
Yeah.
So going into pregnancy, I feel like we've hit everything we kind of want to talk about in pregnancy. Remembering that if there's any health conditions you have, we can treat them.
Yeah. And I see so many people come in for fertility, they fall pregnant and they're like, I don't need you anymore. But it's like the things that we started on, we do need to finish.
Because we're reducing the risk of the miscarriage, and just because we've killed off that bacteria in the vagina, we didn't actually get to put all the good bacteria in, which is going to then impact Bub's health. Then through that vaginal canal, when we're getting birthed, we're not going to have
increasing
that healthy
risk of like new pathogens entering as well.
Yes.
Because it's the male's penis, the male penile microbiome that determines whether or not the female will have BV. And then that's going to increase your early pregnancy loss risk.
Yeah. So, speaking of which, before we dive into preconception and miscarriage risk, what I wanted to touch on is AMH levels a little bit more, because a lot of people believe that they can't change. So
They can change.
I've had first-hand amazing experience with a client's AMH. She told she wasn't going to be able to fall pregnant. We worked on her AMH for 4 months and she fell pregnant after that. So what we did is we looked into some nutrients that can cause AMH levels to be lower. Specifically, the biggest one is cortisol, stress, and hormones. Second thing is vitamin D. So vitamin D deficiency, her levels were 50. We got that to 120.
Amazing.
So again, if you have vitamin D deficiency and you don't find that you're absorbing vitamin D, look at your liver, because liver has to activate your vitamin D. So you need to look at your liver health, detoxification profile and whatnot. And so we had to do a lot of activated vitamin D with this patient because she had liver detoxification issues. We didn't want to do too much detox though, because she was in her preconception preparation. So that can impact the
DNA fragmentation.
DNA fragmentation of the fetus, which then has a negative outcome. So if you want to do detoxification and proper heavy metal work, you need to start 6 months prep before you want to fall pregnant. 3 months preparation, it's only giving us enough time to work on nutrients and egg health and a little bit of microbiome work, but even then we can't do lots of kill off or anything like that unless we're before the 3 month mark.
So if you're thinking of falling pregnant in the new year,
you're
too late. Yeah.
So you want your 3 months prior to, so say you're falling pregnant in 3 months time, that gives us enough time to do your nutrient work, checking in on your microbiome and put the good bacteria back in and work on our nutrients.
Do you want to know how many of my clients that were up to like reseeding that I get, and we're not even actively trying here, that are sending me emails that they've fallen pregnant? It kills me how many, because I'm just like, it just shows you that your body healthy is optimizing your fertility.
Yes, I had a client that I put on some CoQ10 and activated bees because they had MTHFR and they weren't trying to fall pregnant. She's like, I've used the pull-out method my whole life and I've never had an issue. I put her on that and 6 weeks later she sent me a message, oh my God, I've fallen pregnant. She didn't try, but she also wasn't unhappy about it because she thought she had fertility issues because they've been trying in the past, which is amazing.
Yeah.
Literally all I did was give her 2 nutrients. She fell pregnant.
Which are both supporting methylation and egg quality as well.
Yeah.
And that's it's so amazing.
I love it.
I had an email last week that a lady with secondary infertility had fallen pregnant, and I just like happy tears. It was so amazing.
That's the thing that frustrates me as well is the first point of call when you're having fertility issues should not be an IVF clinic, because I've had patients that have come in and been like, oh look, I went and collected an egg. They collected an egg and they did this, and this, but my doctor said I had thyroid issues, but they were refusing to treat it because there's nothing they could do. And so they went and did the egg collection and IVF treatment, even though they knew she had thyroid issues. She didn't fall pregnant. So she spent $30,000 on IVF rounds, even though they knew that she had a thyroid dysregulation. That thyroid dysregulation is what was causing it. So we worked on her thyroid and she fell pregnant.
Yeah, IVF doesn't guarantee you a child.
Yes. And it shouldn't be the first point of call. It should not be the first point of call, because it's just speeding up the process of what your body should be doing itself if it was functioning healthy.
And like throughout my years, I've seen quite a few couples that have had to go down the IVF route and then have fallen pregnant naturally with their subsequent children. So it's showing that there was something happening at that point in time. And instead of unpacking what was happening, could have been low progesterone. You need progesterone of at least 40 to hold a healthy pregnancy. So if we're not addressing that, and then you get put on Clomid and you're stimulating a cycle and all of that, and you've fallen pregnant and you've had a healthy baby, and then your cycle's normalizing as you're coming back through because you've taken all your nutrients during pregnancy, then you fall pregnant with a healthy bub afterwards. Like, what could have been done between here and there that we could have optimized it and then not had to have gone down the IVF route? So in saying that,
saving money by seeing a naturopath, because testing might end up costing you like $800, $900, but it's not costing you 20 grand.
Yeah, it's a slither of the piece of the pie.
And you're actually making your body healthier as well in the process.
And if it's got to go down,
subsequent children.
If you've got to go down IVF, you've got optimal egg quality to go in. Your body is optimized to hold a pregnancy through that.
You're actually improving the IVF outcomes.
Yeah, you're going to increase that.
Everything diet-wise.
Even if it's just an egg retrieval doing that prep work prior,
Yes.
amazing.
So I have a lot of clients that, oh, my AMH levels are low. I'm going to go collect my eggs. And I'm going to say, we're not doing that for 6 months. Why? Because why would we want to collect eggs that aren't optimal quality? They're not going to help you in 10 years' time because they weren't of optimal quality. Let's spend 6 months actually optimizing the egg quality before we go and do a cycle to release those eggs and collect them for 10 years' time when you want to use them.
Yeah.
So my go-to for egg health is checking in hormones, checking in stress, checking in cortisol, checking in vitamin D, which we'll do before you go and get your eggs collected, before you go and do IVF, or to improve AMH levels to fall pregnant naturally.
Yeah.
Is there anything else that you look at for AMH levels as well?
Stress is a huge one.
Magnesium also really helps, but
Yeah.
that's through the stress response.
Yeah.
For sure. So when we talk about miscarriage and preconception, when to start preconception is dependent if you want the best outcomes for your baby possible, which is then clearing heavy metals so they don't transfer over, checking in good bacteria levels in the vagina, mouth, and gut. We don't always have to test for them, but it's more helpful to know what we're actually working with. But we can still work on those without the tests. And then doing nutrient work for preconception and optimizing egg quality. I would say 6 to 9 months before you fall pregnant would be my answer.
Yeah.
If you want the bare minimum, like improving your nutrient ratio and doing some little work with blood pressure and whatnot before falling pregnant, then it'll be 3 months prior. But that's not going to reduce morning sickness risk. That's not going to reduce HG risk. That's not going to reduce cholestasis risk because we need to do that detox before the 3 months prep.
Yeah. So you need 3 months to improve egg quality, pretty much. But if that root underlying driver of that poor egg quality isn't optimized, then it's 3 months that you should have really been doing 6 to 9.
100%. So while we're talking about miscarriage, but yeah, preconception, there's nothing wrong and there's nothing going on, but you just want the best outcomes possible, go and see a naturopath 6 to 9 months before you fall pregnant. Look at doing MTHFR testing and heavy metal testing.
And FYI, we have some great naturopaths here.
Gut microbiome testing as well. That's what we would recommend. If you're having miscarriage, then it's a whole different ball game. So let's talk about miscarriages and the factors first. We're going to try and dive into as many as we can, but we can also maybe consider doing another podcast on it. I think it might be better to do our own podcast actually, because I think it will take another hour. But let's just go through the factors that cause miscarriages, and then we can do this as a series too, because it's going to take a while. But let's go through them so we can talk about it next time. There's hormone issues like progesterone deficiency, estrogen excess. There is MTHFR.
Jinx again.
There's good bacteria levels and bad bacteria levels like parasites, worms, liposaccharides being released.
There's sperm health.
There's sperm health. There's our vagina microbiome health, Gardnerella and whatnot causing miscarriage risk. And infertility.
Vitamin D intracellular communication, so not having enough vitamin D, once impacting your AMH, and 2, that vitamin D is what's signaling the best quality sperm to come through as well.
Nutritional deficiencies,
iron, B12,
magnesium, and then lucky last that I can think of anyway is thyroid dysregulation and thyroid issues like even iodine or selenium deficiency or hypo and hyperthyroidism or Graves' disease. We need to optimize the reducing thyroid autoantibodies just to fall pregnant.
So your thyroid's your master hormone cascade modulator, whatever you want to call it.
100%.
So you can't overlook thyroid in any way, shape, or form. Just to brush over a few risks that you got there.
So those 9 factors would take us a very long time to look into and dive into, and we'll do some case analysis. So we'll save that for our next podcast, and we'll make sure that's the one after this one to make sure it's a follow on. But is there anything else that you would touch in preconception or pregnancy?
It takes 2 to tango. We balanced beings, we offer couples consultations, and that is a really amazing way to get your partner on board as well, to support that, because it's split in half. It is 50-50. It's a lot of the times women naturally take on early pregnancy loss on themselves, and as we've spoken about vagina microbiome, oral microbiome, that is quite self-responded, whereas like I said earlier, it's the penile microbiome that'll determine whether or not a female will have BV. So we can't overlook that male impact as well. We can't overlook that. Sperm health, the amount of clients that I hear coming in and saying like, no, it's a me issue. They've checked the sperm and it's fine. For sperm to be passed through pathology labs, it just has to be at 10%. And then they
It's
say it's all
ridiculous.
fine. So like,
I had
are
a
you
client
happy
that-
with 10%?
I had a client that came in and their sperm was 45%, and she's like, it's not me an issue. I'm like, yeah, but you're reducing your risk of falling pregnant by 50%, not letting that not working on that sperm being optimized. And
Yeah.
there's so many factors that impact sperm health too, like heavy metals and nutritional deficiencies, which we'll talk about in the miscarriage podcast.
Yeah.
The other thing that I wanted to talk about is a really common factor we see as miscarriages and infertility is luteal phase defect, but that is hormone dysregulation as well. So
Yeah.
that we'll touch on that when we talk about hormones, but that's also super common factor too. And also heavy metals can impact nutritional deficiencies, which then cause infertility and miscarriage as well, which we'll touch on.
Yeah.
But yeah, pregnancy and prep. So with prep, if you're just doing a 3 months preparation and you're not doing all the other work to look into what you're transferring over to your bubs, making sure you're on a good prenatal, like natal naturopath or naturopath, and you're on a DHA and choline in preparation, that's the bare minimum. That's the bare minimum.
That's
But
servicing
you should be
your car.
checking your nutrients.
That's not like changing your tires. It's not doing anything else. It's just keeping it running.
Yeah, and that's not checking in on nutrients that you might specifically need to even fall pregnant, like vitamin D. If that's not high enough, that prenatal's not going to be enough needs for what you need.
And as a naturopath, I like to see people as individuals as well. So it's more about, so that prenatal's got X amount of vitamin D. It's not got exactly what your body needs
at all. That needs to be catered for you.
That's just keeping you here. It's not going to replete you if you're nutritionally depleted.
And remember that if you've been having trouble falling pregnant for more than 3 months, that is a sign of infertility. 3 months of actively trying is a sign of infertility. A lot of people leave it a lot longer than that. They leave it, we've been trying, but not really trying for 6 or 9 months. But people typically say they're not really trying because they don't want to put the pressure on themselves, but they are trying. Remembering that if you've got 3 cycles and you haven't fallen pregnant, that's actually a sign of infertility, that there's something going on. And the reality is a lot of people are facing infertility these days. It's so common because we've got so many environmental factors that are impacting our hormones, our nutritional deficiencies, our heavy metals, our methylation, unfortunately. So better to get help sooner rather than later, because not only are you going to improve fertility outcomes, but you're improving your future baby's health.
Yeah.
And their DNA.
Amazing.
So thank you guys so much for joining our podcast on pregnancy and birth preparation. Our next one will be on miscarriages. Until next time, may your health be natural and your days be balanced.
Thanks. Bye.